Our view is that if we're going to get anything done, there's going to have to be a mixture of public and private sector initiatives. That's the real gulf that exists between conservatives and liberals, between Republicans and Democrats, and often the special interest groups versus those that have traditionally been supporter of health care reform. And I think that we have to find a virtue out of everyone's second favorite choice. Each of us comes into this process saying, here's our top priority proposal. And in the past, if our top priority proposal did not get adopted, we either walked away from the table or we opposed what's left on the table. And another way of saying that was all of our second favorite choices was the status quo.
States would have to decide whether they are going to have an individual mandate, employer responsibility, government, additional government participation, etc. So we have the states making those decisions within federal guidelines. They don't get the helping hand from the federal government unless, in fact, they meet the specific coverage requirements. So rather than decide that question in Washington, we made the decision that set the federal guidelines. These are the benchmarks you have to hit over a period of time, and then the states would have room to decide this question of individual responsibility, employer responsibility, or additional government responsibility. So they could decide how they make those decisions, but they'd have to make them within a specific period of time to get the federal funds, or else there would be a federal program that would begin to take hold.
Right now, if you leave your employment, of course, you lose your health insurance. That is a problem. We think that individuals can make better choices to meet their needs of themselves and their families. And an individual with a young, healthy family may choose a policy that addresses certain things like, are my kids going to get the immunizations? Am I going to have access to a doctor when my child gets sick? Whereas an individual with a complicated illness may make a different kind of choice with an insurance plan that offers more choices, more access to higher cost drugs, etc. Again, Americans are very good in every other aspects of their lives of making choices based on value. And so this really gets back to what is the value that we're getting for the money that we're spending as a country?
We developed this plan a year ago, and my members wanted to do a number of things. One, they wanted to build on the current system. I mean, their belief was that if we change everything too radically, we first have little political likelihood of getting it through the political system, and second, we don't know what the outcome would be.
So the private-public mix
they built on the private-public mix. They wanted to achieve universality, and so they looked at the various groupings, income groupings, knowing that many people who are uninsured are connected to employment in some way. There are no mandates on employers. There's an individual mandate, but there's heavy subsidization for everyone below 200% of poverty, and some subsidization up to 400% of poverty in our plan. And for the least, those who can least afford it, they would go into the public programs that they may not be eligible for now. And for those who have some income or offered coverage by their employers, they would receive a subsidy to help them pay for their coverage.
Through tax credit or?
Well, we didn't want to use the tax system. We actually, in our plan, assumed that you could structure this through Social Security and make sure that everyone would get, in a sense, a piece of paper or a certificate if they were eligible, and receive a subsidy directly to pay the insurance they might have to buy in a reformed insurance market, or hopefully, if they're offered insurance by their employer and they're low income enough and they turn the insurance down now, they would receive a subsidy for the amount that the employer charges to the employees in their insurance. We actually, our plan would actually end up affecting about 115 million people, more than the 47 million uninsured, because the notion here is that we want to shore up those who are lower income and may be insured now but may not be tomorrow.
And then if in fact we're into broader healthcare reform, then I think it's a matter of who runs the program and how much flexibility do you have around it. States have experimented a lot, have done a lot over the last 10 years. They have a lot of expertise now to bring to the table. I'm assuming that it's going to be a state-run program if it's, in fact, more of a comprehensive program, that they will not follow a federal Medicare approach, that it'll be state-administered. If that's true, then I think states would want a lot of flexibility on how they set up their alliances in terms of matching providers to new people coming onto the rolls, so that they're able to tailor the programs more closely to the needs of their citizens.
No question about it that the public approach is a very interesting one, and would probably provide the kind of coverage that is necessary. But we have to also recognize the fact that we have to have the political will to accomplish this, and if there has to be some combination, we're willing to really address that and to take a close look at it.
Medicare for all, I guess, is one way you could have a uniquely American plan. I don't see it in the cards. I don't think the next step in our healthcare system is probably getting rid of the employer-based healthcare system or going to a more government, involved healthcare system. I just don't think that's what Americans see as the next step.
Well, there are some instances. Let's take, for example, the single payer approach. I mean, there are some among us who probably would like that, but don't think it's politically realistic. And so that hasn't been a sticking point for us. Nobody's going around saying single payer, single payer. People tend to say, and I'm talking about my partners now as well as AERP, we tend to say we've got to be realistic. Politics is the art of the practical. We're probably going to need some kind of a public-private hybrid partnership. So let's work on that.